Matt Pryor, who's a porter at Colchester Hospital and a Unison rep, and who's playing a leading role in an ongoing strike at East Suffolk and North Essex NHS Foundation Trust, or ESNEFT for short.
Hey everybody, thanks for kind of coming out and listening to me. Not as sustained as my guests here, but thank you. I'm just going to start what I thought was a very apt quote for tonight from the well-renowned journalist John Pilger, a man who never shirked from saying the unsayable, and he was one of the biggest advocates for the NHS. The NHS crisis is the product of a political and media construct known as austerity, with its deceitful weasel language of efficiency and hard choices. Austerity is an invention, and Britain is a rich country with a debt owed by its crooked banks and not its people. The resources that would comfortably fund the NHS have been stolen in broad daylight by the few, allowed to avoid and evade billions in taxes. As you know, I represent my colleagues who are on strike at ESNEFT, which is essentially, for those who don't know, is Colchester and Ipswich and community sites. To cut a long story short, we're going on strike to protect ourselves from the cuts to our wages and the benefits you get from being part of the NHS, but also to try to protect our patients and the taxpayer from being screwed over again. Our industrial actions give more people a voice to stand up for themselves, and one the trust has had to listen to just by the sheer strength of numbers that we've had involved, both physically on the picket line and every strike day, and every one of us who isn't on shift when they should be. A voice that's always been ignored, forgotten, or just deemed not important enough by those above us. Simply because we represent the lowest paid workers in the trust, the people I work with are proud to have the NHS badge on their uniforms, and they do it because they want to help people in whatever role that they're allowed. Not because it's well paid, because I can assure you it certainly isn't, as every one of us is only paid barely, not even a penny above minimum wage. To get any more than that, you have to do the most unsocial hours going. This means precious time away from your families, your loved ones and your friends just to get a semblance of a living wage. Having been part of the Carillion Health portfolio, we were brought back in-house in the winter of 2012. So myself and other colleagues that remain from privatisation know full well the stark difference between the private and the public sector. Running on skeleton staff all the time and corners cut in every sort of way you can imagine. All the while making the patient experience worse, just to line some shareholders' pockets. Retaining a private company, it means we've had our enhancements we could get cut, our pensions would be frozen, and our working conditions would decline as a result. This leads to driving people into further hardship and potentially onto the breadline, particularly when we were already the lowest paid in the trust as it is. This will in turn affect our local economy, with less money to spend on goods and anything outside of the basic essential needs. One way that we think we can resist any further damage to the service and the community we represent is, we want to have like a united approach from all unions, not just like health unions, but all together. One, we're fighting the NHS outsourcing should be a whole trade union movement issue across all of us, as it is very much a crucial working class issue. With Carillion, I was well placed to see that standards of care decline with outsourcing, which further degrades obviously the standards of the NHS. The NHS is constantly under scrutiny by politicians and the media for failing to deliver on its promises due to underfunding, but that's not popular discourse in the mainstream. Obviously this creates a vicious circle with further failing of the patients and demoralisation of staff, and that leads to expanding the demand for private healthcare under the guise of reform. However, there will always be a section of the population on the lowest incomes who won't be able to afford private healthcare. And outsourcing obviously then leads to a two-tier system. Under the pretense of delivering efficiency, under the guise of NHS austerity. It actually does nothing to save money for the taxpayer, just a pretext for growing a for-profit sector that takes advantage of people's needs for decent healthcare and to fund new markets of private companies. The NHS is something we've all used at some point in our lives, and we all rely on in times of great need. Something the UK can be rightly proud of. The NHS was founded on proper socialist values of providing a safety net for those who couldn't afford any other sort of adequate healthcare. The greatest legacy of any government since the Second World War. Labour helped give birth to the NHS, and now they need to pray they're going to protect it into its old age. As the alternative is a slow death by 1,000 cuts by privatisation. Without the generous donations of thousands of people, from thousands of pounds from other unions and branches into our hardship fund, we just couldn't have got this far. The backing that we've received locally and from across the country has inspired us to keep fighting and to carry on striking for as long as it takes. We realised very quickly that with a fresh Labour government in place, what happens to us could dictate the future of the NHS for the next 5 years. I can assure you there's still plenty of desire and fight to strike, as we know that this dispute is of national importance now, and as it's indicative to the future of our health service. There's going to be no backing down from us, and we'll carry on fighting tooth and nail. And this, I'm here on behalf of my colleagues at ESNEFT, the porters, the cleaners, the caterers, help desk, general office staff, goods receiving, postman security, all without whom the hospital failed to run smoothly, but have now been deemed expendable. Thanks for listening.
Thanks, Matt. It's really